just like Russian dolls. I mean, you're basically doing surgery on the baby. Ooh. I was watching a medical show the other day in which doctors did surgery on a baby's spine before the baby was even born. Now, it was impressive because to do this, they had to cut through the mother's abdomen, through her uterus, through the fetal membrane, take the baby out, do the surgery, and then put it back. And at this point, they cut to another scene, but I was left with the overwhelming question, how do they sew all those layers back up again and do so well enough that the baby is carried to term? Well, Dr. Chowdhury is an expert in regenerative medicine at Queen Mary University London, and I'm going to ask her that question now. Tina, hello, thanks for taking the time.
Hello.
Okay, so I teach a module in physiology, and I always talk about fetal physiology a little bit. I don't spend any time talking about some of the things that can go wrong, like preterm birth. And I know that sometimes that can happen because of a ruptured fetal sac. Can you tell us a little bit about, first of all, how important is this with regard to, how prevalent is it and what's the impact on society?
Preterm birth is a really big problem, especially in the UK. I mean, in England alone, we're looking at 1 in 9 pregnancies leading to preterm birth, 1 in 9. And in London, those numbers increase to 1 in 7. So it's a massive problem. And in terms of cost, the cost to the NHS is absolutely huge. I mean, this is costing billions and billions of pounds.
There are several reasons for preterm birth, but one of them is a tear in the fetal sac or membrane. In fact, around a third of preterm births are because of the fetal sac rupturing. Now, this can happen on its own, but it's also a common after effect of fetal surgery. When surgeons operate on spina bifida, for example, they need to cut through several layers of tissue: the mother's skin, abdominal muscle, the uterus, and the fetal membrane. Afterward, they need to sew all of these things up. The fetal tissue heals well, as do the mother's abdomen and womb. But the fetal membrane is where doctors currently face problems. They're just like Russian dolls. I mean, you're basically doing surgery on the baby. How does that heal, and how do you help that with what you do?
Okay, so I'm going to talk about the structure. I mean, the fetal sac's really interesting. I mean, it's a bit like a balloon, because the fetus is growing inside this balloon, and this balloon structure is expanding in shape and size. Now, the balloon structure is programmed to weaken with age. So in other words, it has to structurally degenerate and break down.
Because the baby's got to be able to get out of it when the water is supposed to break.
Yeah, absolutely. But that has to happen at a specific time. And if it happens after 37 weeks gestation, then that's the perfect time. That's when mum's going to have a healthy delivery. She's going to give birth to a healthy baby.
In this microscopic image, the sac looks like wrinkly leather with a hole in it. But the situation is actually quite complicated. The membrane is a composite matrix with rubbery connective tissue on the bottom and live cells along the top. And all of this has to expand throughout the pregnancy. So, as it's growing, it needs to maintain integrity whilst also preparing to get weaker at the right time to allow rupture. It's a careful balancing act. What's happening with a tear in the fetal sac?
It's interesting because there are actually lots and lots of cells there, but they misbehave. Okay. Some of the cells are really good, some of them are really bad, and some of them really ugly. And what happens is that there's a whole cocktail of mechanisms, processes that happen all at the same time. So on one side, the cells are being told, right, you're not going to fix this tissue, you're not going to heal, you're not going to repair. But then you have this other population which think, right, I'm the army, I'm going to try and fix and repair this hole. And those are the cells that we have been trying to understand, because we feel that these cells are really important in repairing that hole.
Okay, we're going to take a deep dive into this cell biology because it's fascinating. Tina has figured this out using a technique called fluorescence microscopy. Special stains that glow different colors are added to the tissue. They bind to very specific molecules and pick out different cells and components. Here, we see that the rubbery, mostly cell-free connective tissue is colored red. The blue bobs, however, show us individual cell nuclei. They show us where the cells are, which is wrapped around the surface of the connective tissue. In the upcoming images, we will see that there are at least 3 different cell types, what Tina refers to as the good, the bad, and the ugly. In this image, there is a type of cell highlighted in green that is lining the membrane hole. These are the good ones. These cells have a special substance inside that's highlighted pink. This substance indicates that they are trying to repair the hole. But there are also cells that are releasing the pink stuff and creating plaques. These are the bad ones. They're bad because the plaques that they create deform the cells, which prevents healing. Then there are cells that do nothing except get in the way. These are the ugly ones. So there's this tug of war going on between the different cell types. Armed with this new information, Tina can create ways to promote the good cells that ultimately have to heal the hole. And so do you just encourage those cells to go to the wound site, or do you have to actually sort of plug up the wound site itself first?
Okay, so what happens is that it's actually quite difficult for the cells just to rebuild all the structure that is needed to plug that hole.
On the scale of a cell, it's this huge canyon, right? The cells are way on the other side.
Absolutely, it's massive. So we've got to try and plug that hole with a material. So we use a material that is soft, but also very, very stretchy. And the good news about the material is that those cells, they can clamber all the way to the edges of the wound. They move around really, really fast into the material, and they're really happy because it's their new home. So they start to rebuild, they start to build that scaffolding structure, and they start to fix that hole.
Okay, let's recap. There's this massive hole in the fetal membrane, and surrounding it are 3 types of cells: the good cells, the bad cells, and the ugly ones. And what Tina is doing is putting a special material in here, a scaffold, that gives off chemicals that attract only the good cells so that they clamber out onto this material and lay down fresh, healthy tissue. Tina's scaffold looks a bit like a jelly bean, but when you zoom right in, you can see that at the molecular level, it's made up of all of these little strands. They allow the scaffold to stretch as the fetus grows.
And the beauty about this sort of technology, the word that we use is called nanotechnology, is that we can organize the material properties so we can make it more soft or more stretchy or slightly more environmentally friendly for the cells so that we can maintain the properties. Because remember, not only are we plugging the hole, we want to make sure that that balloon-like structure can continue to grow as the fetus grows.
So you've got to add something that can stretch along with the growth.
Absolutely. So we need a very elastic material that can cope with that structure. So it's a really sort of very multidisciplinary field because we've got the material chemistry as well as the engineering properties of the material all coming together, plus the biology and the medicine coming together to try and help seal, fix and repair the hole.
Where does it go next?
We have to make sure that the clinician is able to do the surgery. So the next step in our work right now is to get lots more funding and demonstrate clinically that when we deliver this material through the fetoscopic device, so this is like a little miniature telescope, that the surgeon can deliver the material so it doesn't lose its material properties or its engineering properties, and it can plug that hole.
And so this little telescope also has like little grabby arms.
It's a bit like a miniature robot. So the robot mechanism is really, we have 2 approaches that we're developing. They have mechanisms that allows it to rotate and move. We're using soft robotics to try and manipulate the delivery mechanism so that it can precisely introduce the material within the defect site so that the surgeon can then pull the mini telescope out. He can then close the other different layers of the tissues, close up the wound in the mum, and then mum can return home a few days later and carry on with pregnancy.
Here it only has to last for 8 weeks, right? Because it's going to be shed with the birth, so it doesn't have to be incorporated into the body forever.
So we're hoping, so if the fetal surgeon is performing the treatment at around 20 weeks gestation, then we would like the material treatment to last for the next 10 weeks until 30 weeks of gestation, because we know for a fact that if mum delivers at 30 weeks gestation, those babies are healthy, they'll have good survivals, they'll grow into healthy infants, into childhood and adulthood. Yeah.
Cool. Thank you for sharing your research with us. And hopefully there'll be far fewer preterm babies because of the work you're doing.
Thanks for popping along.
I started out wanting to know how doctors could repair the holes, the damage they had done in a pregnant mother when they do surgery on the fetus. And I learned that the outer layers can be sewn up rather easily, but the fetal membrane presents a special problem. To fix this, they have to put in a special patch, which is a nano scaffold. I learned from Dr. Chowdhury that the cells that repair the site can become confused, but by infusing this scaffold with various chemicals that lure the cells on and get them to do their appropriate jobs, they can repair the fetal sac properly. Doctors who do the surgery then need to withdraw their equipment and fix the layers as they go. It's much like doing surgery on Russian dolls. While pretermism remains a massive problem, by combining bioengineering know-how with surgical skill, hopefully we can reduce the number of preterm babies. Until next time, remember that between the question and the answer are all of the really tasty bits. Look, Senor Bad One. Hey, we don't need no stinking badges.
Honestly, who puts peas in a sandwich?
Well, he put you in the sandwich.
Yeah, but I'm an important MacGuffin for the narrative arc.
Maybe you should make a Egg McMuffin.